All right, everybody. Welcome back to the Brass Tass Business Podcast. Today, I'm super excited. Our guest is the definition of a high performer. He's not only CEO of Kaizo Health, a multi-location chiropractic practice. He's also the founder of Embodi, a technology platform for healthcare to improve healthcare providers' outcomes globally. He has helped elite athletes. He's led groundbreaking research and literally helped shape the future of chiropractic care, from the Washington Redskins Cheerleaders to the International Olympic events, from Inc. 5000 to tech innovation in healthcare. Dr. Jay Greenstein has done it all. Please welcome Dr. Jay to the show. Doc, thanks so much for being on. I really appreciate it.
Well, this is an honor for me because we first met when you were one of my CAs, my chiropractic assistants, and you were a rock star. And I was like, this dude is going places. And it's been an honor for me to watch your career blossom the way that it has. None of it has surprised me, but all of it is just incredibly awesome because you deserve all the success that you've got.
Thank you so much, Jay. As Jay said, I did. Jay used to be my boss. He also, whether he meant to or not, he did become my mentor. It wasn't until, was it last year, the Business Summit in DC? The Business Summit, I didn't realize, I took my staff there, I took Holly there, and I was like, you got to come to this. Dr. Jay was my mentor. He was my first chiropractic leader in the group. And as I was there at the Business Summit, I was like, wow. My staff turns and looks at me, and Holly's like, wow, Dr. J's like a lot like you. He seems to talk like you. He kind of, even with the long hair, I mean, mine's pulled back and he's got the long hair. He kind of looks like you. And I was like, believe it or not, a lot of the things I picked up, it was probably working for Dr. J. So Dr. J, I owe you a lot as well. Thank you so much. Little things here, now that I have my own practice and I've got, multiple doctors, I definitely appreciate your leadership back in those early days of being a rehab specialist back then it was Sport and Spine Rehab.
Sport and Spine Rehab, that's right.
Yep.
Well, you were always like one of the great CAs that I remember, and you always just delivered incredible value. I didn't really have to coach you very much because inherently you are just so patient-centered and you really care about the people that you work with and that you care for. And again, it's just incredible to watch your career blossom, man.
Thank you so much. Well, Dr. J, you've got a pretty incredible resume yourself. You're obviously a doctor of chiropractic, CEO of Kaizo Health, a tech advisor. You're also a coach, a tech founder now. So when you're not working, what is something, you like to do on your day off, if you ever get a day off?
Days off are hard to find, but I love traveling. I love going to the gym. Love hanging out with my dog. I love to ski. Haven't been able to ski in a couple of years. It's been super busy, but I do love skiing. I love eating. I love good wine. So I try and find these little pockets of things that I could do. I just mentioned to you that I just got back from Israel. My sister lives in Israel and I was visiting her and her family. So travel and food and wine and exercise, all those things, make me very happy. Oh, and by the way, love football. And I'm a huge Ohio State Buckeye fan, and my team won the national championship this year, so I'm a happy guy.
There you go. There you go. We need to somehow figure out a way to mix the business and pleasure and have maybe a coaching group and an Ohio State game happen all at the same time in a box suite.
Right.
I remember when I was working for you, you had the box seats for the Caps. Is that still a thing that's happening with Kaizo Health or not as much?
So I didn't have box seats for the Caps, but you guys won Clinic of the Year. That's how awesome you guys were. And so what I did is I rented out the box for all you guys because you guys were the best clinic that year. So didn't have a box, for, the entire season, but that was a really fun night. I still have pictures on my computer from that night. That was super fun.
That's awesome. That's awesome. That rubbed off on me, Dr. J. I always remember when I was working for you, you would just randomly, this was when I was working at the McLean Clinic with Dr. T. You would just randomly show up and buy lunch for everybody on a Friday. And I was like, oh man, that was really cool, Dr. J. And then, we got to go to the Caps game, which is like still a memorable experience. It's probably the only time I've sat in a box seat at a Caps game. Other little things, when we have our quarterly meetings and things like that. And I've tried to transition that to my staff, and it's so interesting how some staff is different. Like I had staff, a couple of years ago that they could care less whether I bought them lunch. And I was like, wait a minute, Dr. J bought us lunch, and now I'm doing it. They don't really, now my staff, they're all foodies. They absolutely love it. And I'm like, well, guys, thank Dr. J, because he was the one who planted the seed and taught me to give back to my staff. And now I've learned as a business owner, you gotta, give back to your staff, and it's all because of you.
It's the relationships that matter in life and in business. Somebody said to me, the other day about like, oh, like I understand it's not personal, it's just business. And I'm like, nothing could be further from the truth. At least for me. I mean, the way that I think about life and the way that I think about business is like, it is very personal. Like I want it to be personal. I want to have personal relationships with people on my team. I want them to have a great experience. And I think one of the most fulfilling things that we do in life is build strong relationships. And, just like this one right here.
There we go. Well, I know you grew up in Maryland, before becoming a healthcare advocate and, pioneering sport and spine rehab then and Kaizo Health now, and now you've gotten Embodi as well. Did the young Jay Greenstein have the same dream, or was it different when you were growing up, going through school and
I was an absolute fuck up, Keith. I mean, like, I was like, all I wanted to do was play. Like, I wanted to play football and chase the girls. Like, that was it. Like, it's all I wanted to do. Even in college, like, my major was like beer drinking and basket weaving or whatever. Like, I just didn't study until I changed my major. So I was a marketing major for my first 2.5 years. And I was just like having a great time in college, right? Like it was just fun. But when I finally figured out what my life's purpose was, which was chiropractic, that's when everything changed for me. And then, I saw what my mom had gone through. She had had multiple car accidents. She'd been completely mismanaged by the medical system. She was given drugs after drug after drug. And I knew that was ruining her life. And then she found chiropractic and it changed her life. And so it ended up through her introducing me to her chiropractor. I decided I was going to become a chiropractor. And once I knew that, then I attempted to study. Now, I wasn't a good student still. I didn't know how to learn, but that happened later in chiropractic school. But yeah, when I was young, I was it was all about play for me.
Well, what's one of the values your mom or anyone else may have instilled in you back then when you were, just having fun, doing the things to now, being getting into chiropractic? What do you feel like is one value that your mom or family members has instilled with you that has been consistent throughout?
Honesty.
Okay.
Yeah.
Yeah.
And when I was a kid, there were times when I would lie. Like, did you have that cookie? And I'd be like, no. And then my mom knew I had the cookie. And back in the day, they would use their hands, if you know what I mean, right? Like, I know maybe it's not politically correct these days, but I felt the hands. And so there was that part, but then there was also my father and his business reputation. And I would, their adult friends would come over and I'd be a young kid. And I would just always hear my parents' friends, especially the male friends who did business with my father, talking about his reputation and how strong it was and how honest he was. And that has stuck with me to this day.
Okay.
Yeah.
That is one thing. I think we brought this up when we had lunch a few months back. You sent me a text message once, and this was years ago, and it was something about my BS, my bullshit bravado, and it always stuck with me. Like, I'll never forget that text message. And at the time, I was probably in my 20s, and I remember like receiving that from you, and I was like, oh man, because you were somebody I respected. You were somewhat of a mentor to me. And so I was like, oh man, that kind of hurt a little bit. But now, like years later, I think about it and I was like, man, Dr. J was like 100% right. Like you were just being honest, and like you did it in such a good way because it wasn't offensive at all when you texted that to me. But I was like, man, he was spot on. And I'll never forget that, because sometimes when I do get cocky or I do get arrogant, I'm the youngest of four. So I'm always been battling with my older siblings and trying to be, a little bit bigger than my shoes, so to speak. And I think that has got me in trouble sometimes. I always think about Dr. J and being like, yeah, temper your ego a little bit, Keith. So I 100% agree. Honesty is one of your virtues, Dr. J. You've been on some pretty big stages. You've done a lot of speaking. I've been pleasure to it. You've done it with the NFL, Olympic events, international conferences. What's one totally unexpected hobby that maybe most people don't know about you?
I collect football helmets, Hall of Famers, and Heisman Trophy winners. So just below me, I've got over 100 helmets that are signed by Hall of Famers and or Heisman Trophy winners from back in the 50s all the way to present day.
I got to see that collection sometime. I got to see.
I'll take a video and I'll send it to you.
Thank you. Thank you.
Or you'll come over. You and your wife will come over and we'll have some fun, right?
That would be great. That would be great. Well, I know a lot of, I'd like to first kind of start talking about Kaizo Health and the different chiropractic offices, because one of the things that really resonates with, I'm sure, a lot of your patients and me as one of your former staff is you were very evidence-based. In your experience, what's the biggest misconception people still have to this day about chiropractic care? And do you think that's changed over, your time in the industry?
That's a great question. And I think the biggest misconception is that chiropractic is not real healthcare. I think that's a big misconception. And I think it started because of the American Medical Association's desire to contain and eliminate the profession of chiropractic. That's not an opinion. Anybody who's listening to this podcast can just Google AMA versus Wilk, which was the antitrust case that was filed against the American Medical Association for working to contain and eliminate our profession. So there's decades and decades of social information that was not correct about our profession that has permeated our society and permeated the societies around the world that really led to people not understanding what chiropractic is, which is actually true, holistic, evidence-based healthcare. Chiropractic works. Like, it's been published in Annals of Internal Medicine, it's been published in Lancet, and many, many, many other journals. So I think this idea that chiropractic isn't real healthcare is a misconception, and we are all working to fix that. The second part of your question, which is it changing? And the answer is, I believe absolutely yes. I don't know what you're seeing, but for me, there is way more acceptance, way more understanding. We don't really have to convince patients like that chiropractic can help them. There's enough content out there at this point for them to know. And so I'm glad that it's changing, and we still have a lot more work to do. And I think we have a lot more work to do to continue to fight the injustices that we're dealing with at the legislative level, at the regulatory level, and even at the competitive market level with the insurance companies and not wanting to pay for benefits and having benefit design that rewards patients for going to a doctor that's going to give them drugs that's not going to solve their problem, compared to rewarding patients by creating lower copays for them to get evidence-based, effective, functional healthcare. And those are the battles that we must and will continue to fight on behalf of our patients and our communities.
So glad you brought that up, because I was telling my associates the other day, chiropractic has infiltrated mainstream media. It's in rap songs. You see it on TV shows now. Like, guys, people like you, Dr. J, have done the hard work to get us where we are now. Like, I think, I haven't been doing this as long as you have, but I see it in my patients. Patients are people, the layperson is much more knowledgeable about when they go to a medical doctor versus when they go to their, doctor of chiropractic. They know what they're going to get when they try, the medical route, and they know it, or I feel like going the chiropractic route, they are getting a better idea of what they're going to get, and they see the value in it. So thank you for all your hard work, because I know you've been a pioneer in that realm. Me
and many others alongside me and before me, there's just been a lot of people that have put their heart and soul into this profession for the benefit of our patients and to create justice in the healthcare system. And I just want to say one other thing really quick, Keith, if I may. This whole idea about Make America Healthy Again and having Kennedy as the chair of Health and Human Services, and like, those things actually matter right now. And I think it's indicative of how Americans are looking at the healthcare system and saying, we've been indoctrinated with taking this drug or taking that drug and then having to take another drug to deal with the side effects from the first drug. All of that, like, Americans are waking up and saying enough is enough. We know what creates true health. We know. And so why not have elements of our society promote those things? Eating right, exercise, good sleep, appropriate behavioral and mental health interventions, chiropractic. All of those things can make a huge difference and keep people healthy instead of waiting for our bodies to break down and trying to take a drug to fix the problem. So I love what's happening in this country right now as it relates to healthcare, and it's going to continue to evolve and change for the better.
What I'd love to ask you is, I notice a big change in the younger generations as well. I feel not only in my office, but some of my colleagues, I'm seeing a lot younger demographic that is getting, and I don't know if this was post-COVID and maybe that had something to do with it. You've got, I know, clinics across the DMV. Are you noticing any, changes with the younger generation taking a more active role in their health and in your clinics?
Absolutely. And I agree with you. Like, I think COVID did play a role. I think they saw what was happening. They saw the government interventions, they saw the policies, they saw the vaccine, they saw all these things and said, maybe we need to rethink healthcare. So yes, we are seeing a more educated population base. We're seeing younger people starting earlier to take care of their bodies, which is the right thing to do. And I think that's going to benefit, of course, not just them, but the healthcare system at large.
And you've built Kaizo Health into a nationally recognized brand. I remember when I worked for you, you had 6 or 7 offices. Across those offices, Doc, what do you feel like what's clinical or operational system has been most critical for you to keep just such a consistent level of high quality care in your clinics?
Yeah, two things. On the clinical side, it's been our Rehab 360 program, which is like how we deliver clinical care. So there are standards for consultations, examinations, manual therapy like adjustments or soft tissue work, standards for exercise progressions, like those things has been the clinical foundation of our business. On the business side of things, it's been the entrepreneurial operating system. So, Gino Wickman wrote the book Traction. It's the EOS system. We took that system and applied it to our businesses. And honestly, it's been transformational for us. That happened many years ago. I was actually trained by Gino. I got really lucky. I was pretty early on and he was training people at the time. So I got trained by the guy. And that's been a huge blessing for us as a business.
Glad you told me about that book. My staff absolutely loved it when we went over our core values. So everybody listening, Dr. J and I had a luncheon a couple months back and was like, you got to read this book by Gino Wickman. And I was like, okay. So sure enough, I read it. And every Monday we have our Monday meeting. And most of the time I feel like my staff is just staring at me like, here goes Dr. Keith on his rant again. But when we did core values like they recommend in that book, I was like, thank God for Dr. J, because they were actually engaged. It was huge. So if you
Yeah.
haven't read the book, Traction by Gino Wickman, basically, Jay, you base all your practices off that book. Is that correct?
All of our businesses, even Embodi, like our technology company, our coaching company, like all of it is based off of EOS. And I just want to give you some kudos. Like, bro, you are light years ahead of where I was as a leader at your stage in your career. Like I was still a cluster F and at your age, and like you are just light years ahead. And it's just so awesome for me to see like how you think about leading your team and understanding the importance of things like core, because you could have read the book and done nothing, right? But you said, yeah, you know what? This is actually really important. I'm attaching meaning for my practice and my people and connecting those dots. And the fact that you're doing that at your stage in your career is just remarkable, man. And you should feel really proud about the work that you're doing, not just on the clinical side, because I know you're an amazing chiropractor, but on the leadership and people development side of things, you should just feel really great about yourself.
Thank you so much. Now that I'm going to more of I'm still seeing patients, but getting myself out of the clinical role and getting into a more leadership role, it's hard, and you told me, Jasmine was the one who told me too. She was like, hey, listen, you're in for a surprise. So thank you for all your help, and whatever other books you can text me, I'll read them and do the best I can. But I'm glad you brought up Embodi, because you sit at the intersection of healthcare and technology. How do you see digital tools like mobile apps and AI transforming, patient outcomes and clinical performance, either in your clinic or in years to come? What are you seeing on the horizon?
Yeah, digital health is a huge, massively growing industry. And I believe that if we can engage patients when they're not in the clinic, they're going to have a better experience and a better outcome. It's really that simple. Like standard kind of traditional chiropractic is like you see the patient when you see them, and then you hope that they go home and they do their exercises, and you hope that they're doing well with their care journey. But if you don't know how they're doing, so many different things can happen. They can fall through the trap door and not continue with their care plan, or have an exacerbation and think chiropractic's not for them. But even though you might have explained like, hey, sometimes you're going to feel worse after treatment, sometimes you lose that connection. When you lose the connection, you lose the patient, and that's tragic for their healthcare journey. Forget the business use case. It could be tragic for their healthcare journey. So my core belief is that we must engage with today's technology. We must engage patients when they're not in the clinic to support their care journey holistically. And with the use of these technologies, inclusive of AI, where we can actually provide a very meaningful conversational experience with them and clinical experience as well, where the AI can kind of identify what they need next that's going to be best for them. I think it's a game-changing initiative. And so that's why we built Embodi. We're still young, we're still growing, we're still learning, but this is the hardest thing that I've ever done, but the most fun I've ever had. Because to your point, it's like the intersection of chiropractic and digital health and technology. It's like, wow, this is super fun. And when we get to this point where we're already showing improvements in retention and revenue. Like we just submitted a manuscript to a peer-reviewed publication that will get published in the next couple of months that has demonstrated like really high levels of retention and revenue based on Embodi users versus non-users. And we're looking at behaviors versus outcomes as well. So as we continue to evaluate the data, and we can clearly show that Embodi users have better clinical outcomes faster, and they're doing the right things for their health, both in the short and the long term, we know we've achieved our mission. Like that's really why we exist, to drive improved healthcare outcomes over time. And if patients are getting better outcomes, providers deserve more income. And so there's a revenue opportunity for these providers as well as they use our technology. And that we think is like the secret sauce.
Just icing on top of the cake at that point.
Exactly. That's exactly right.
And with Embodi, how did you even, had you been in this arena before? Like, how did you even create the idea for Embodi? Because I feel like Jasmine's been telling me about it for years. She's like, why don't you have an app? Why don't you have an app? And then sure enough, Dr. J goes and invents it. So how did you kind of think of this idea? Did you have other tech people that were friends in the industry, or how did this all come about?
So we're going to come full circle here because as you had told the audience, our company name, our practice name used to be Sport and Spine Rehab. And in 2018, we realized we needed to rebrand because there were too many sport and spine and or rehab names that were out in the field and there was brand confusion. So we changed our name to Kaizo Health. Kaizo is the Japanese word for rebuild or reconstruct. And our tagline is rethink, rebuild, restart. We want people to rethink healthcare. We're going to rebuild people's bodies so they can restart their lives. And as we're going through this entire process, I said to people on my team, guys, like this can't be just about a new logo, new colors, and a great tagline. It's got to be like, we need to rethink our business. So what can we improve upon? And the area that we really wanted to focus on were what we call self-discharges, patients who discharged too soon, who did not complete their care plan. And we looked at all the data, and you know that we're a very data-driven organization. The number one reason why patients self-discharge, Dr. Keith, is because they what? Do you know why? If you had to guess, why do you think they self-discharge?
Poor outcomes. They're still.
Nope. It's because they felt better. So patients feel better and they think they're done.
Why do I need to come back if my pain's gone?
Exactly. They were focused solely on the symptoms and not on their overall function. And so I was like, okay, what do we need to do to engage patients in ways that they've never been engaged with before? And what ideas can we come up with? So we did this question storming exercise, and ultimately gamification bubble to the top. Like if we gamify the experience, if we have a rewards program for a chiropractic practice, would that drive better engagement? And the answer was yes. We published 2 studies on it. You can find it in PubMed. And so our first product was we just gamified the experience, and that's what we did. And it worked. And we weren't collecting any healthcare outcomes data because we couldn't afford to build a HIPAA compliant product. So we brought on over 60 customers. I think at our height of that product, it was about 65 customers. And that revenue paid for us to build Embodi. And so now our product is a native product. We're collecting healthcare outcomes. We're collecting literally every patient and every provider behavior that's taking place in the interaction in a patient care journey is being tracked. Everything is being dataized, like there's data around everything. And so we're able to get really great insights into what actually is driving the outcomes and the income that we're looking for. And that's what Embodi does.
Can't argue with the data, can you, Jay?
Data doesn't lie, my friend. Data doesn't lie.
Well, with the Embodi program, how many clinics do you have Embodi in now?
We have 10 early adopter clinics right now.
Okay. And what do you see for the future of Embodi? You know, obviously you've got the study and the research to prove that you're getting better patient outcomes. Is the idea just to get it into more clinics, get more data, or what's kind of the future of Embodi?
The future of Embodi is definitely to get it in more clinics. Like we really want to grow this business, and we will grow this business. Where we have focused our attention early on is product iteration. So with our 10 early adopters, we're able to get like a lot of feedback. We've even asked you for feedback, and you're not a customer. We continually do that so that as we iterate the product, we make it even more impactful. And as we iterate the product, it allows us to go to more electronic health record companies because we need that integration and say, look at what we've built. We've built something really smart. We've built something really strong, and your customer base needs it. So now, Keith, we have some of the largest EHRs coming to us, reaching out to us because they're hearing about it from their customers, but they can't get it yet because they don't have the integration. They're coming to us and saying, how do we integrate? And so that's really the position that we wanted to be in, and that's where we are right now. So we're talking to some of the largest EHRs in chiropractic to integrate.
That's awesome.
Yeah.
Do you see this going into other industries? Like, could you implement this with other EHRs, or you're going to stick with chiropractic?
It's a great question, and the opportunity is there. We really believe like physical therapy, mental health, functional medicine, all of these elements that can benefit from behavioral economics and data science, any of those professions can benefit, especially if they're like repeat customers like chiropractic, physical therapy, functional medicine, where there's these repeat episodes or there's these repeat interventions from the provider to the patient.
Your experience speaks for itself, Dr. J. You've now got multiple successful chiropractic offices. You've now got this new successful AI company called Embodi. What do you feel like is the one principle, leadership principle, that separates the good leaders from the great leaders?
Oh, I mean, look, what the evidence says is self-awareness. Like the evidence says, like in many of the publications that are out there, sure, you need vision and you need great communication skills and you need, the ability to think strategically. Like all those things are important, but the science says one of the most important leadership, if not the most important leadership skill, is self-awareness. But I would add 1B, which is grit. Angela Duckworth and her work around grit. I've seen her speak several times now, read the book. Grit is really, really important. And those leaders that can get through the struggles and just really, again, it's passion and perseverance for long-term goals. When they set their mind to it and they're not going to quit, those are going to be the leaders that succeed the most.
I'm so happy you brought up grit, because that leads me to my next question. Every entrepreneur, whether you're in the healthcare space or any type of industry, faces challenges. On that tone of grit, how do you feel that when something doesn't go as planned, how do you feel like you pivot or can even grow from that type of challenge?
Well, it's taken a long time to get here because it wasn't always this way, but I read the book The Obstacle is the Way by Ryan Holiday.
Love it.
And
Yep.
And that I was going through a really rough period as a business owner, as a leader, and I read that book and it really did change my life. And one of the quotes in the book is from Marcus Aurelius, and it goes like this: "What stands in the way becomes the way." And realizing that whatever you're facing, whatever you're dealing with, is actually a lesson that's bitch slapping you in the face. And if you're not paying attention, you're just going to struggle. But if you're paying attention, you'll actually benefit from it. So what lessons are we learning when we run into these challenges? Asking those questions of myself and my team allows us to push through and have that grit and get to the other side. And as leaders, as you know, we're always going to have challenges. And the harder the shit that we do, the bigger the challenges, but also the bigger the reward. And I'm not talking financial reward. I'm just talking about that intrinsic reward that says, wow, we've done something really important in the world. So yeah, I can ramble about this forever, but what stands in the way becomes the way is one of my mottos for sure.
What's the biggest growth that you've seen in yourself, and not financially, but personally? Because you've now had, I'm sure, multiple challenges along the way. I didn't realize that's funny. On my first podcast, I did it with a dentist, Dr. Claustro. She got me crying like a little baby at the end of it. I was like, great. On my first podcast ever, you got me crying. Because at the very end, she was like, Dr. Keith, I'd like to ask you a question. Why'd you do this podcast? And I was like, and it made me really think about it. And I was like, I did this podcast because I want to convey to people how hard it is to start your own business and have multiple businesses. It's extremely hard. And I'm a huge advocate of small business owners. So what do you feel like for you, Dr. J, has been the biggest challenge in your career, and how has that helped you grow personally?
I'm going to answer that question, but I just want to give you a shout out again, acknowledge what you've done. I saw a quote from Alex Hormozy the other day. It's like, what separates the people who make $100,000 a year versus $100,000 a day is the fact that they're willing to go out and make a fool of themselves. They're willing to go out and do the hard things that, nobody else wants to do. They're willing to go out and try things and get outside of their comfort zone. And so you've done that with this podcast, and I just got to acknowledge you for that. So kudos. I think the biggest lesson that I've learned through my journey as being a business owner and an entrepreneur is that I've developed an incredible level of self-awareness. Like I really know myself so much better than I ever have. And that journey continues. It doesn't stop. But like, I didn't even recognize that I was the world's shittiest leader until I realized that I needed to become a better leader. And then when I became a better leader, I needed to continue to become a better leader, right? It never stops. But like, I was a terrible leader and didn't know it. That's bad. That's bad. So
you got to know what you're good at. You got to know what you're bad at.
Yeah, for sure.
Your strengths and weaknesses. I feel like every interview I have, I'm like, so what are your strengths and weaknesses? And when people, number one, they don't admit their weaknesses, but then you're right. You've got to acknowledge your strengths as well. And you got to know what you're good at versus bad at.
Yeah. So I think, that level of self-awareness has helped me a lot in business and has helped me a lot in life for sure.
What do you feel like still drives you to this day, since now you've been doing this for decades. You wake up every morning is because I feel like one thing about you, Dr. J, you have an incredible amount of passion. Even I was telling my staff, they were like, why are you so excited about this podcast? I'm like, every time I talk to Dr. J, he gets me all like, jacked up. I'm like, he's got so much passion. So like, what drives you every morning? What gets you out of bed? What is it that you feel like, do you feel like some people just have that? Or is that something that, you've just gotten lucky and found a career that you're very passionate about?
Yeah, it's such a good question, all of it. And I don't know, like I would assume that everybody has it, and I've just been very fortunate to find it, right? So what drives my passion on the chiropractic side of things, taking care of patients, running those businesses, advocacy work, is justice. I want justice for our profession. I want justice for our patients, for our communities, because the American healthcare system is completely unjust. Everything from insurance companies, third-party administrators, pharmacy benefit managers, the legislators that get paid tens of thousands of dollars, hundreds of thousands of dollars, millions of dollars to just vote on legislation that supports all the criminal activity that happens in our healthcare system. Fucking pissed. And that drives me every day to fix that stuff. On the Embodi side, I think it's...
Yes.
On the Embodi side, changing mojo, I'm a little calmer now. On the Embodi side, I'm really thinking through this answer. My first response is just like this challenge of building a product that's never ever existed on this planet that might change the world. Like, I think that's really it if I were to describe it in the best way possible. And it's super hard, but like, I love it, Keith. Like, I just love it. It's so fun, so hard. But like, I'm like, God, if we can change people's behaviors and they could be healthier because of it, and we could do it at scale, holy crap. We've done some really good shit in the world. So that's what drives me.
Jay, since you were so passionate about the justice, can you just tell our listeners, because I don't feel like you have a very unique perspective because you've been in the trenches, right, with these insurance companies, can you let our listeners know about like what's really going on with, let's just maybe be specific about chiropractic and just how our industry has been unjustly treated over, and maybe what you've seen, because I remember when I was working for you, you were trying to do the independent physicians network and all of that. And now fast forward 20 years, like what were you seeing then? What are you seeing now in the injustices in our healthcare system?
Well, inherently the goal for insurance companies is to collect premiums and then not pay out benefits. I mean, that's the model. They make their money on the float, on their investments like that. I've heard the president of Aetna say that at a healthcare blockchain conference. Like, it's not a secret. Like, this is the model for them. And so they put so many obstacles in our way to get paid a fair amount for the value that we deliver. And they bring in a third-party administrator that likes to do medical review or utilization management to see whether or not the patient actually needs the care. And you've got a suit sitting in an office in Peoria, Illinois, making a clinical decision about a patient in your office. And that is unjust. And it's not good healthcare. And it's not good for anybody. It's not good for the system. And it's not good for the patient. It's not good for the provider. That's just one example. I mean, pharmacy benefit managers, there's a whole like relay of money that's going back and forth, which is causing, and I'm not a big fan of drugs, but sometimes patients need medications. It's causing like a massive rise in drug costs because there's so many middlemen that are getting paid just to deliver a pill. Other healthcare professions deal with the injustices as well. I don't know it as well because I'm not in those professions, but just, again, as an example, we've never gotten raises commensurate with rate of inflation. Like the insurance companies cut our rates of reimbursement. They don't increase them over time. That's just another, how are we supposed to run our business? Rent goes up, our employees want more money. We want to pay them more money. Our expenses go up. How are we supposed to actually make a living and no profit, no mission? So we have what's called the Future of Chiropractic Strategic Plan. It's chiropracticfuture.org. Anybody can go take a look. We've got a reimbursement task force. There are 26 high-level problems that we deal with. Here's another example. Insurance companies are making us get paid through virtual credit cards where they take another 3% out of our reimbursement. I didn't ask them to do that. Who do you think owns the virtual credit card companies? Just guess. Now they're taking 3% and earning 3% on every freaking transaction. They automatically opt us into it. So now we've got to scramble. Who do we call? Who do we speak to? Who do we email in order to get paid like a normal EFT into our bank account like we should be paid? It is like whack-a-mole for healthcare. Every day there's a battle that we need to fight in order to just get paid a fair amount for the value that we're delivering. I'm sick of it, but I'm not giving up. We're going to continue to fight these injustices because You know me, Keith, I believe in karma. You do the right thing, good things happen. You do the wrong thing, it's coming back to get you.
Have you seen changes in the time that you've been in this field from what you used to do, 10, 20 years ago to now, or is it just getting worse?
I think it's getting worse. It's sad to say, but I think it's getting worse. They're becoming more sophisticated in their ways to not pay us. Bundling codes together, we do two different services, but they only want to pay us for one. There's another example, like they're using AI to deny claims. There's lots of information out there. Aetna and Optum, two competitors, colluded to deny Medicare claims using AI. These are our parents and our grandparents that need these services. They need to be covered for these services. And these large multi-billion-dollar insurance companies are using AI to deny claims for the elderly. Like, what? So it's getting worse because these insurance companies are getting more sophisticated. So how do we fight back? We have to own our own data. We've got to use AI and analytics as well. And we've got to keep pace with the rate of technological change. And that's why another thing, like why Embodi is important to me, because I'm also educating doctors on just digital health and the use of AI and reimbursement. And doctors need to understand that they've got to keep pace. Otherwise, they lose.
Why are us chiropractors so antiquated when it comes to technology? I'm like, even going to your business summit, I was like, I finally know how to use AI thanks to Dr. J. But why are chiropractors is it just resistance to change that we're just, this is the way we've been doing it? And I don't know. What is it about?
It is $1 million question, but I have two answers for you. You ready? 1, 2. Our hands work so well for patients. The chiropractic adjustment is so powerful. The things that we do with our hands, that we get such great outcomes that I think a lot of chiropractors think, well, I don't need to keep pace with the rate of change because I can just use my hands to take care of patients and I'm good. But the universe is becoming much more sophisticated these days. And if we want to stay competitive and we want to stay in the game, we want to deliver even better experiences for our patients, including our two hands outside of the clinic, we need to make sure we're keeping up with technological change. That's where digital health and AI comes in to really chaperone that care journey for the entire course of care in the clinic and outside of the clinic.
Looking back at your Dr. J version when you graduated chiropractic school, what would you tell yourself now, years later? What advice would you have for yourself, for your younger self?
If I were to start all over again? That's a good question, Keith. I probably would have said the following. Build your leadership skills a lot sooner. Hire better people early on, and make sure in the spirit of weaknesses that you bring people onto your team who have strengths that you don't have. So, Kat has worked with me for 16 years now. You guys worked in the clinic together. She's brilliant. Like, she is the person. She is the yin to my yang. Like, operationally, she's like very process oriented, detail oriented. I know that's important, but I suck at it. I don't want to do that crap, right? Had I had somebody like that all of those years, like I had other great people on the team. I had Kurt, I had Bart, but they were also more like me. Visionary thinkers, big picture. I needed people earlier on who were very focused on process, SOPs, and execution. And I didn't do that well in the first 10 years of the business.
And that's such a pivotal part of business. How do you find those candidates? Are there certain things you notice, certain questions you ask? It's almost like a needle in a haystack. So how do you find those rock star employees that you've had over the past years?
Yeah. First is self-awareness. You've got to use like a lot of the standardized tests to learn about yourself. It could be strength finders. It could be like what's called the PDP, which is a great one that Chiro Matchmakers has. If you've never used it, it's really, really great. It's been spot on for me and my associates. You've got, Myers-Briggs, you've got grit scale. So when you're in the interview process, using these assessments to first identify whether or not these people align with your core values, and then figuring out if they are the right person in that seat based on your weaknesses, that's the key. And so we do a lot of personality assessments on our team. And I think that's been extremely helpful. Like, I know now what my weaknesses are. I know where I need to fill those gaps, and they're large ones. And so the assessments really, really help.
Years from now, what do you hope people say about you, Dr. J, if you were to fast forward 10, 15, 20 years from now?
Oh, that he was a good person and that he had great impact on the world. Now you're going to make me cry.
Yes. Well, you've had a huge impact on me, Dr. J. There's no way I'd be where I'm at now without you. How can people find you? How can people learn more about Embodi? Where can they learn more about you and all the businesses you've got?
Sure. So I'm on like all the social platforms, Facebook, LinkedIn. Instagram, Dr. J Greenstein, you'll be able to find me. You could also look up Embodi, Embodi, if you're listening to this. My email address is drjdrjay at embody with an I, health.com. You can email me. And if I can be of help in any way, just, feel free to ask, and I'm happy to help any way I can.
Awesome. Well, I thank you so much for being on the show, Dr. J. You've been, as I've said multiple times, you've been a great mentor, and I think our listeners are going to love the value you just provided. So thank you.
Well, thanks for having me, brother. It's always great to spend time with you. Let's do lunch again soon, man. All right?
Sooner than later.
Sounds great.
Good, Dr. J. Thank you.
Thank you, brother.